Welcome back to Studio 10. It is time for On Your Health. This is where we discuss important medical and health topics with the doctors of Florida Medical Clinic, the Bay Area's first clinic to merge both primary care physicians and specialists all under one roof. And today we welcome Dr. Geoffrey Cronen to discuss how untreated deformities of the spine can lead to some very serious medical issues. Welcome to Studio 10. Jeff?
Thank you.
Dr. Jeff?
Yeah.
We're
on
a first name basis. So you are you an orthopedist, or what is a spine? You're a spine specialist. What is that? What is the exact term for that?
So I did an orthopedic residency.
Okay.
And I did an additional year of training in spine deformities.
And what exactly is scoliosis? Because that's one of the ones that we hear about the most prevalently.
Scoliosis is a curvature of the spine of 10 degrees or more, and occurs in about 1 to 2% of the population.
Do we know what causes that? Because I remember being in school, you know, they bent you over and they checked your spine to see if it was curving. What causes that?
There's a variety of different genetic factors. There have been all sorts of theories over the years, and actually they thought it was related to melatonin at one point, so they took the pineal glands out of a bunch of chickens trying to induce scoliosis, but all they wound up with was a bunch of chickens that couldn't sleep very well with straight spines. So. But we still don't know is the short answer.
Now, when we say that spinal deformities can translate to greater medical issues, what are we talking about here?
So when curvatures in the thoracic spine, or the part where the ribs are attached, when they get up beyond a certain point, they can start to affect heart and lung function. And once they get up over about 90 to 100 degrees, it can result in early mortality relative to the normal population.
Is that just because of the pressure it puts on the heart, which is unnatural, or what? Does it restrict blood flow? What happens there?
Well, a combination of those things. It can result in what's called pulmonary hypertension, so a restriction of blood flow, and that backs up within the lungs, and that affects lung function, which then affects heart function, and it's a kind of a vicious downhill cycle.
Tell us what we're looking at right here, Jeff. Go ahead and put up the first picture. We've got a before and after.
So that is a patient of mine who she's 32 years old when she came to see me the first time. She's a CPA. She had a young 2-year-old child. She had post-polio syndrome, born in Kuwait, raised in India, and she'd been followed over the years and was developing a severe progression of her scoliosis. So her lumbar curvature there had gotten up to about 105 degrees.
Oh, gracious.
Wow.
But she still functioned very well despite that.
Isn't that remarkably painful?
Well, that was her issue, as she started developing more and more pain and more difficulty with ambulation.
So what were you able to do to help her?
So you can see the image on the one that was on the left there, and the one that was the initial x-ray. The post-operative image showed the correction. So she had about a 6-hour procedure that involved what's called a posterior spinal fusion with instrumentation from T2 down to her sacrum and pelvis.
Okay, and we'll actually, if we could put that up one more time so that we can get Dr. Cronen's, again, explaining it so that we can see it, that would be wonderful. Okay, there we go. So, so when you say that you fused, explain that one more time.
So the image on the right there, you're seeing the patient standing from behind, and at each level there are 2 what are called pedicle screws, and you can see those in the spine here when we come back to this, but at each level there's 2 screws, and then there are rods that connect all the screws together to hold the spine in place until the fusion occurs. So fusing a spine is essentially tricking the body into thinking there's a bunch of broken bones, and the body then knits all those back together into a fusion, and the instrumentation, the screws and the rods, hold it there until that occurs, and that can take about 6 to 12 months on average.
Talk to us about this next image that we're going to pop up here in just a second. Holy cow.
Oh, that looks terrifying.
Wow.
So that was a girl that was brought over from a country called Moldova in Eastern Europe. She had surgery in Romania when she was in her teenage years, and it failed. If you look real closely there, you can actually see one of the rods broken in a couple of places. And she had about 140-degree curvature, and along with another local surgeon, we did a 2-stage surgery on her and corrected her.
Her spine looks similar to the model that you brought in here?
That's actually a printout of her spine.
Turn it a little bit so everybody at home can get a pretty good idea about, boy, look at that.
Oh my gracious.
Wow.
So she, the technology that we have these days is amazing. That's a 3-dimensional printout. So you take a CT scan, plug it into a machine, and it can pop that out. But that was her spine beforehand. And
how's she doing today?
She's doing great. She's actually she got married about a year ago. I just got an email from her the other day asking about some back pain during pregnancy, but she's 7 or 8 months pregnant right now.
And we have we have an after photo.
Oh,
I believe.
let's take a look at that then. We can see what Dr. Cronen was able to do for her. Look at that. That's unbelievable. And doctor, I mean, you say you get an email from a patient. I mean, you have a very special relationship with your patients. It's not just somebody comes in to see you one time and is forgotten. You actually keep up with your patients.
Well, I always follow all of my patients over their lifetime, but I do try to keep in touch with them. Most of them have my cell phone number. I get the CPA that you showed earlier. I got a text from her boyfriend the night before Christmas with her before and after picture side by side, saying how happy she was that she could wear normal clothes again. So I do keep kind of close contact with most of my patients.
We hear you do a lot of work with the Lightning too.
The Lightning, the Shriners.
Is it frustrating when you see the guys in the Lightning out there skating around and taking a hit, and you're going, oh, they're screwing up my work. What are you doing? Come on.
Fortunately, they don't have too many spine issues, so.
Good to know. Hey, to learn more about the latest advances in patient care and medical research, visit Florida Medical Clinic online at floridamedicalclinic.com. And while you're there, you can locate the office nearest you, learn about their doctors, and even request an appointment.
Thank you, Dr. Cronen.
Thanks, guys.
Nice to see you.
Up next, HGTV's Sabrina Soto shows us how to make our homes a holiday showplace while being easy on your wallet. We'll be right back.
This segment was sponsored by Florida Medical Clinic.